Good afternoon, ladies and gentlemen, and thank you for standing by. Welcome to the Ovarian Cancer Canada Bowels and Chemo Conference Call. I will now turn the conference over to Fran Turner, National Program Director. Please go ahead.
Hello. Ovarian Cancer Canada welcomes you today to the second session in our new telephone education series for women with ovarian cancer and their caregivers. Today's program is entitled The B Word, Dealing with the Bowel Side Effects of Chemotherapy. We know that today's speakers will provide you with helpful information about this troublesome side effect of treatment. I'm Fran Turner, National Program Director of Ovarian Cancer Canada. Ovarian Cancer Canada endeavors to provide women with ovarian cancer and their caregivers with information that they need, and we hope that you will find this session informative and that it addresses your questions. I'm delighted there are survivors, family members, and healthcare professionals from across the country in our audience today. We hope that you can help us by giving us your feedback. An evaluation form will be sent to attendees through email or regular mail. So we would appreciate your thoughts about today's sessions and your ideas for upcoming telephone education series sessions in 2008. If we don't have your email address, please let us know. So getting on with today. In the B Word, Dealing with the Bowel Side Effects of Chemotherapy, our two speakers will give their presentation, and then members of the audience will have an opportunity to ask questions. You will be given directions by the operator once the presentations are completed about how you go about asking your questions. Our first speaker will be Lori Ellett, who is an assistant professor in the Department of Obstetrics and Gynecology at McMaster University. She is a gynecologic oncologist at the Juravinski Cancer Center in Hamilton, Ontario. Dr. Ellett is a researcher and has at least two studies addressing ovarian cancer, one for the processes of care for women with ovarian cancer and another treatment decisions in recurrent ovarian cancer. Dr. Ellett also very generously contributed to the development of our You Are Not Alone resource book for women diagnosed with ovarian cancer. Our second speaker is Janet Giroux. She is an advanced practice nurse in the Obstetrics and Gynecology program at Kingston General Hospital, and she works with gyne-oncology patients. She is a co-chair for the next biennial Region Oncology Nursing Council Conference to be held in Kingston in the spring of 2008, and she is also an active member in the nursing group of the Gynecologic Oncologists of Canada. So please, Dr. Ellett, go ahead.
So welcome, everybody. I'm supposed to give you some of the science, I guess, behind the bowel side effects of chemotherapy. So I have two objectives. My first one is to help you understand a little bit about the bowel issues that exist at the time when a woman is diagnosed with ovarian cancer. And second of all, to help you understand some of the bowel problems that arise as a result of chemotherapy. So you understand that there is a tension. There are some symptoms that women come to us with when they have a diagnosis of ovarian cancer, either prior to their treatment, be that treatment with surgery or treatment with chemotherapy. And then that tension is balanced by the issues that chemotherapy brings to the table. So to first of all talk about what are the bowel effects of ovarian cancer, Barbara Goff published in the Journal of the American Medical Association in 2004 that there were about 102 women who were interviewed. Half of them had ovarian cancer and the other half just had ovarian masses. And they were asked a number of questions. About a third of the women said that when they had their first diagnosis of ovarian cancer, they experienced bloating, and about 1 out of 5 experienced constipation and abdominal pain. So certainly bowel issues are present before any treatment occurs for women with ovarian cancer. It's part of the underlying presentation of ovarian cancer. When a woman receives chemotherapy, there are side effects to that chemotherapy, and I think of it from the mouth right through to the rectum. So it can be issues with how well you feel to eat. And in medicine, we talk about anorexia and having a feeling of early fullness or not feeling hungry at all. There can be nausea or vomiting, and that can be related directly from the chemo or just from the idea of going to the cancer center to be seen by the physicians who prescribe the chemo. There are issues around constipation, which again are related to many of the medications we use to prevent nausea and vomiting. Some rarer issues in ovarian cancer are mouth sores, and these can not just be in the mouth, but can be involved in the tube that goes to the stomach or actually into the stomach. And these are related to some of the drugs that we can use in second-line chemotherapy. And lastly, diarrhea, which is a new complication in ovarian cancer care and seems to be arising out of some of the biologic treatments that are currently being used. So let's talk a little bit about what women would say are the worst symptoms related to bowel side effects. So Sun in the Cancer Care publication in 2005 asked women if one explains perfect health, what would they say constipation would rate? And women said with ovarian cancer that constipation rates at a 0.5. It rated at the same level as memory loss, sexual dysfunction, and hearing changes, and it seemed to be more of a problem for women who had recurrent ovarian cancer than women who presented up front with ovarian cancer. Although in Sun's study no one had vomiting, there was a particular aversion or anxiety about nausea or vomiting related to chemotherapy. Nausea and vomiting has been shown to negatively impact the performance of activities of daily living, and it's known to be a very strong predictor of a sense of well-being. And before we had drugs like Zofran or ondansetron, ganistotron, or the other name is Kytril, nausea and vomiting were very common. But now that we have drugs like Zofran or ondansetron, Kytril, or ganistotron, over 90% of women now say that nausea and vomiting are not an issue while they're receiving their chemotherapy. However, the new issue that's raised its head during chemotherapy is constipation, and that tends to affect about 21% of women who are on these drugs like Zofran and ganistotron, these 5-H2 blockers. So it's really important when someone is taking these particular anti-nausea medications that they're on a bowel regimen to try and prevent constipation from actually becoming a problem by starting stool softeners and monitoring their bowel function.